welcome in, and thanks for joining us here today at Apolitical. I am your co-host, Azra Mahmood, and I have Brian Watson in the background.
What's up,
And we are here with our guest to come talk to us about some really important things that you all are wondering about. This is Tahira Karriem. She's an RN and a medical professional in the Valley here in Phoenix for the past nearly 15 years. And I just thought that she would bring great information and real information that we can use to find out what's going on behind the scenes, get that insight. So with no further ado, I just kind of want to welcome you in, Tahira.
Thank you. Thank you.
Thanks for being
here.
Thank you. Thank you for having me.
Here we are.
Here we are.
And oh my God, what a year it's been. And so many people are reflecting and thinking about like what all has happened and all of the different anniversaries that have come about with all the heinous things that occurred in our country to the point of this crazy pandemic life that we've been living.
A panini, as most people refer to it.
What is it?
They refer to it as the panini.
Oh, it is. For sure. I had not heard that.
Yeah.
I've heard the panty.
Yeah, there's a bunch of different, ways that people describe it,
Yeah.
Right.
So here we are, and I just feel like, God, it's been a lot. And I think everyone is wondering, like, how do we keep moving forward? And I think vaccinations are one of those hot button topics that everyone who's gotten the vaccinations are done. They've gotten them. They're fully inoculated and are starting to live life a little bit to, what was considered more humanistic and out with their friends and getting some fresh air and being in at least open spaces a little more comfortably.
Right.
And then you see all of these mask mandates kind of loosening up all around the country and sometimes here.
Yeah.
And I'm just curious, Tahira, we've had these conversations, in the past a little bit. Like, what are your thoughts about vaccinations and our Black and brown communities? How do you think Arizona and the nation is working on that these days? Like, do you think everyone's got their vaccinations now? Or the hesitation even?
I think it's really interesting because I think to a degree, I think we're unfortunately getting to the point and what I don't want to see this take a negative effect, but I think people are getting vaccine discussion exhausted. And that tends to kind of happen when something has gone on for a long time. You're hearing it a lot. And that unfortunately can cause people to get desensitized from what the central issue really is and what's really going on. We're seeing a lot of the discussion shift towards everybody getting vaccinated, everybody hurry up and get your vaccine, and all the incentives that are out there right now. Come and get a vaccine.
Lottery, hello.
The vaccine lottery. Right. I heard it called vaccine and scratch, which sounds terrible, by the way. But we're hearing that. We're hearing, like if you want to come to the baseball games, you got to be vaccinated. You can come to the concert if you're vaccinated.
Vaccine passports.
Passports, yes. So all of these incentives are out there for, it's trying to create this buzz. But like I said, I feel like you're on the flip side of it. There's the population of people that made up their mind a long time ago, either way, one way or the other. And it can kind of set in some vaccination exhaustion discussion. Especially if they're not in a space where they're being exposed to what's really happening to people that actually get COVID. And so that's the discussion that I'm kind of disappointed is going away. Like, we're not talking as much about what's really happening to people that are getting the virus, especially in our community, right?
Yeah.
So, and what that looks like. And we've known, like, a lot of media coverage has reported, especially in the last year, about the healthcare disparities that exist in the Black and brown communities and how the care just is not the same.
Right.
Well, we still don't want to lose the sight of the fact that in proportion to all the other races and ethnicities in the country, Black people were the ones dying the most.
Mm-hmm.
Blacks and Latinos, okay, we can't leave them out of the conversation, dying the most. And so that's some of the discussion. I'm like, it's sobering when you actually see some of these statistics and hear that data, and gut wrenching, right? It like really hits you in the gut. But unfortunately, that's the reality, and those are the things we can't get rid of. A lot of the discussion from the people that I'm hearing that are like, I'm not getting it, and negative discussion about the incentives that are going on.
Mm-hmm.
Unfortunately, I heard a newscaster, this was a discussion recently, of course, I want to say it was a Fox newscaster.
Of course.
Give it to Fox.
Was saying that this was the vaccination Jim Crow, right? So it's like, how much are you not reading the room right now? You are not definitely in touch with what really has gone on in our American history. But unfortunately, they're at an advantage to not get the vaccine, if that makes sense. They don't live in areas that are highly congested,
right,
and diseases are easily transmittable. They could, they don't use public transportation a lot. They're not working the front lines and coming in contact with people repeatedly. So what we're seeing is the right-wing Republicans that live in rural areas are really, really, really the ones that are vocal about being against getting vaccinated.
Right.
But they have the privilege to do so. They're not dying from it because of it, like Black people and brown people are. So
if I were to interject, okay, I'm sorry, go ahead.
No, go ahead. I was just going to say it just goes right back to socioeconomic issues.
It does. It does. I mean, if you think about our major cities, that is where you're going to see people more densely populated, and they're going to be people of color, right?
Yeah.
So, of course, increasing the probability of you coming across someone that might have it. One.
Yes.
Two, our access or ability to have access to the type of healthcare that, should we contract the virus, our chances of survival are limited. And then the other aspect of it is the fact that we are a vulnerable community where we have a lot of pre-existing conditions based on the fact that we don't have good healthcare, and we're consistently in these environments that are toxic environments, whether you're talking about a major city or you're talking about the fact that the jobs that we have, we're normally the essential workers or people who are in constant contact with people, working in some of the jobs that require us to be face-to-face with people and not working remotely, you know, as some people get the opportunity to do. So I think that's really key. But I'm going to throw something at you that is debatable, or at least people have said it's debatable, to say that there's one side of the argument that says that the reason why Black and brown people aren't getting the vaccine, this is just one side of the argument, is the fact that A, they don't have access to it, and B, a lot of times you have to register online, and that there's a digital divide when it comes to either knowing the site to go to and register the information, or just getting online, period. So I just
a really great point. Yeah, I've heard that too.
That is absolutely a really good point. The interesting thing, though, I have to say, is the digital divide being there. I need to look a little bit more into that, because I'd say a couple of things, actually, because they have made things accessible from your phone. Okay, so that's the piece that I think people, maybe that would be the space where people are not realizing where the accessibility is coming in. You actually can schedule your vaccine appointment from your phone. Now, the thing that is the unfortunate piece that I have the biggest problem with is that a lot of these county health departments that were setting this stuff up were not thinking about proper ways of making this information reachable across the net, right? Because unfortunately, like if, and I'll just use Arizona for an example, like you can't just go to just the county health department or just the central place where you think you need to go to get it. It's actually on like a subsidiary site. And so you have to go through multiple places to get to it, if that makes sense. So that's the thing that's a problem. And most people that ended up finding it had to talk to somebody else who already went through it. And they're like, oh, okay, now this is how you get it. So there's that access of information. And if you're in a community that's not seeking out that information, you don't have those warriors around you to help guide you to get to the right info. So that definitely, I think is, there's definitely some truths there all around. And I think that would probably be the biggest takeaway is maybe people don't realize that you don't have to like sit down at a computer and search this stuff out. You can do it directly from your phone.
Okay.
There was the first thing I want to make sure I didn't miss the first thing you said, because I was.
So it was also like, literacy. So there's one thing now I can get online. The other is, what site? How do I search?
Yes.
And that other stuff. You know what I mean?
Yeah, finding all that stuff. So one of the things that ways that they've really been trying to spread the access of the vaccine, which I can see how this could be great, a potentially great way to do it. But unfortunately, I think it comes off a little bit corny, is vaccines at the barbershop and the salon.
Yeah.
Right. Yeah. And that's, like putting it in a space where we're at is great. But here's the other thing is that contrary to the popular belief, Black people just aren't still out running around doing what they regularly used to do, right? There's some people that have shifted going to the salon. There's hairstylists that aren't working in the salon anymore.
That's true.
So the crowds of people, the draw, I'm like, we might have missed on that. That's not really the space where we're at. We're still going to the grocery store.
That's a good point. That's a great point.
The market.
Yes. And I found, Tahira, is that they're available at Walgreens and CVS.
So those are the places that we're still going to. Yeah. I'm not like, like looking for getting my hair done anytime soon. I'm just saying, there's some of us that are really, really like that. I think that the way that it's hit our communities, a lot of our people have really had to stop going to see their loved ones. We might think about, unfortunately, I feel like Atlanta got a lot of coverage about like people aren't slowing down, but that's just one city. That's just one data point. That's just Atlanta. I had friends in Harlem, and they were encaged in their house. Mm-hmm. So it's not the same everywhere you go. Right. So that's
life has been hard. I know just from my personal experience, right? Like just even speaking from our personal lenses. So it's definitely, I think, access to where we're at. Would be making the most sense.
I feel like the knee-jerk reaction was to go to those stereotypical places where Black people hang out. And
they've been doing vaccines at some of the churches too, right?
Yes.
Pilgrim's Rest was also, and I thought that was commendable. And I feel like that is viable if you're able to do a drive-through through the church, because it offers just, the space and the comforts of, some of the people that look like you that might be volunteering.
Yeah.
And then you can ask questions and things like that, especially from the standpoint of, knowing that you're more likely to feel more connected to your local community, especially if you know that church is a place that you can trust. And so maybe there's more space for things like that. And maybe there's more space to do it even at some of the local schools and places that we might, congregate. I don't know if Loyalty Lounge would be a place that you could do something like that. Or I'm trying to think what are some of the other hot spots. I don't go out these days like I used to.
Well, see, you just said it.
Right.
Not out like we used to.
Exactly. But people are going out though.
They are. Some of them are. I think that has to do with age demographics too, right?
Mm-hmm.
So
Right.
let's think about where those people are really going to. But like I said, the grocery store, CVS.
CVS, Target.
But thank you for bringing up the churches, though, because there have been a lot of churches that have stepped up to you know, offer that as a service. And I know that hasn't been easy for them. That's another item of concern too, is that we do have these beacons in the community that are actually trying to service the people, but getting access to it has been a struggle in some spaces. And that's something that we as citizens could look out for, right? And start to rally around, because collective voices get heard more than singular ones do.
For sure.
So you know me. I'm gonna just ask that big elephant in the room question, right?
Do it.
You already know where I'm gonna go with this. So
put the elephant out there.
Black community and trusting the government with this vaccination in the first place. I know that a lot of people still do not trust this vaccine in their vaccination in their arm. They're just like, you know what? I'm gonna wait until next January, see where this is at, because I need to see if you are still alive by then.
Right.
Let's really see the side effects, and let's see what outcomes are really to happen. And yes, we're in a pandemic, but I think I'm just going to take spirituality to another level and just stay my butt put and not be out in the streets as much, and just be patient and ride this thing out and see if this vaccine is really what it is.
Yeah.
Right.
So what are your thoughts on that? And what would you say to the people?
Listen, I have that in my own family. Within my own family, there were some people that was like, look, we've been at home for a year. We haven't had to see people. We'll be good.
We'll be good.
We'll be good. But I think it does require us actually taking some healing discussions with ourselves, because it is a space, and I think that this is very valid. It's very, very valid to be in a space of concern about, the safety of the medication. We should be that way for everything that comes out, not just the vaccinations, to be honest, not just vaccines, any medications that you're getting recommended to you that you need to take. It should be of a concern of what is the safety, what does the longevity look like. So there are some interesting things when I actually myself even had to go through and dig and get that information and look more closely at it. So the thing that I would say that I was disappointed about is that the science community was not doing a good job of being transparent about what a vaccine would look like for COVID, what are the steps they're taking to make this vaccine, how this is similar to other things that are being done, because that was all just like under wraps and hush hush until it was like, oh my God, there's a vaccine here, and it happened faster than we thought it could. So then everybody was like up in arms, like,
how do I trust this?
You just came up with this overnight. Well,
right.
Yeah, that's what you just came up with this overnight. And
listen, we're people that should be suspicious, right?
Yeah.
From everything that we've experienced in our environments generationally,
endured.
Keep your head on the swivel when you're, in the hood. As many times as we've been taken advantage of when it comes to social and economic situations that have taken place in the past, voter registration, all the different tricks that have taken place when it comes to keeping us out of loans, mortgages,
all of that,
opportunities for jobs. So that level of suspicion is not limited to the fact that they've experimented on us, right, in the past. There's a history of reasons to be suspicious of not just government, but I'm just going to put this out there, to be suspicious of white people, coming to you saying, we've got an answer for you, right? We've got this figured out for you, this is for you. And so I would say, that they're not wrong. And I think we may be too fast to apply to people that, like, are you crazy? Get the vaccine. Like, it's a no-brainer, you know, because we still don't know what this is going to look like for us in the next 5 years.
Right.
And I think that level of honesty that like it's more receptive to, you know, our community when you just lay it out. Like, listen, I got the vaccine, and you know what? I feel you with the uncertainty, but I got a grandparent that I need to make sure that I keep safe. I got kids that I want to keep safe.
Oh
I
yeah.
got my neighbor over here that, you know, 88 years old, you know, and I help him with things, and I got to be in contact with them. I got to make sure that person is safe. So what are we going to do? What am I going to do? Not get the vaccine and potentially put their lives at risk?
Right.
Yeah.
And so we're doing the best we can with what we know. And what we know is the vaccine works.
Right.
Yeah. Yeah. And it's available to us to provide that additional level of comfort, especially if you know you're going to need to be moving around. You want to be able to visit people and reconnect, go back to work without feeling like you're going to die, and be concerned about your livelihood, and that aspect as well. So those are all valid points. I feel like it is something that we do have to really look at very closely, is what the history of our healthcare has looked like, and demand better. You know, like we can, you know, us taking the vaccine, and I hope that anybody listening to this will just, you know, think about this in a different standpoint, is not us surrendering. Okay. It's not us saying that we trust them wholeheartedly and everything is fine. Okay. You still have the right and the ability to raise your voice and say that, you know, the care I've received before was inadequate and we need to do better and demand better, right? Especially, I feel like now would be the time. It's like the healthcare industry is kind of on its heels, right? It's kind of on its heels. You're going through all these lengths to incentivize Black and brown communities to come out and get vaccinated. Well, now that's when you say we need to push you a little bit further. If you're going to be, you know, giving us lottery tickets and free groceries and, you know, a beer for getting a vaccine.
That's crazy.
And donuts, okay, all the stuff that's unhealthy for getting a vaccine, then I also need you to go a step further and make sure that there's some diversity in these hospitals, and there's some, you know, that that I'm able to get seen in a timely fashion when I come to the emergency room in my neighborhood. I don't have to drive an hour to go to the emergency room, you know. So this is not a time to be like, well, yes, okay, I'm gonna go ahead on and get it, I guess. No, it's still there is still the opportunity for resistance, and that's still very much something that we are akin to. That is in our DNA.
It is.
I love that. Yeah. No, you bring up a really good point. So with healthcare being at its heels, you said, right? This is an opportunity for real revolution, right? We're in a revolutionary period. And when you think about, you know, all these shifts and changes that happen, you know, America's slow to change and the government is slow to change, right? So, you know, I have a question here, like, you know, as healthcare costs keep climbing, and we know that Black and brown communities are culturally avoiding doctors and, you know, hospitals as much as possible. You know, even when we shouldn't, when we should be going, we should be getting our, you know, welfare checks. We should be taking care of ourselves proactively, and not when we've got like a lump in our neck coming out, right? Like, you know what I mean? Like, we should really be taking more notice of these things. And I was going to ask you is, what are your thoughts on how vaccines are free right now, right? And so many go uninsured still, even with changes that have happened. So for everyone that these vaccines are currently free, while the EpiPen is ridiculously
expensive,
crazily priced point, right? What are some of your thoughts around that?
So, it's a hot
button. Loaded. I do the hot buttons.
It's a hot button topic for me personally, just all together. My biggest concern with the cost of healthcare is that we're not putting it's dehumanized. I mean, that's my biggest concern. Is there is the healthcare practitioners, for the most part, okay, and the people that work in the industry are there to serve a human race, right? To be concerned about our livelihood, our wellness, and to actually touch human lives. Okay. But the way that the costs are actually being driven totally has no sight of that whatsoever. And the fact that it's difficult, extremely difficult for certain individuals to attain healthcare that actually covers the cost of their health. Okay. Health. These deductibles have gone higher and higher every single year. And we're paying for it. I mean, these are for the individuals. So take out the fact that, yes, we could talk about people that are the population of people that are receiving Medicare or Medicaid. Okay, that's paid for with tax care dollars. Okay, but the citizens that are actually even paying for their health care from their jobs, it's ridiculous. Like, you can be paying $500 a month for your family to get medical coverage, medical and dental typically, okay? And then still have to pay additional $5,000 in the year.
That's crazy.
Before they will cover health care, okay? There'll be a few key items, and this is the other thing that's really frustrating, is that the population we're not immensely educated on what is actually covered in the healthcare plans, right? So your wellness care visits, so if you're not sick, those are the ones that'll be covered. Now, a lot of the vaccines are covered, are a part of that. So especially like the baby shots, all the shots that the kiddos get, and I would believe that like a COVID vaccine would stay in that category. Those can be covered. A flu shot. Those are covered because they're preventative. They should. So things that are in a preventative light are covered. But there can be a fine line between what's preventative and what's not, right? So the moment you get, you can have a genetic disease, okay? Then some of the cost of that care is no longer seen as preventative. That's like an additional cost.
See, I don't know if that's fair, because, and I'm sorry to cut you off, because as I'm thinking about this, right, the vaccine is not a cure, but it's supposed to help your immune system navigate addressing the virus.
Right.
But about that same immune system, right, and any other health issues that you might have, right, we should be making sure that even on a very basic level, everyone has the health care that they need to fight any virus, right, for that matter, right?
Exactly. And so the other piece of it is that, I really think a lot of it is that what's unfortunately happened, and I guess it makes sense if you think about the way that our society is set up as it being a capitalistic economy, right?
Goes back to that.
They really try to stay away from the thought of community. But what's happened in the light of a pandemic is we have to think about community. Like your neighbor getting sick is threatening your well-being. So, if we start to put some of those concepts and principles into actually how we think about the cost of care or where that is spread out, this could be done in a lot different light, because our wellness, really does affect the people in our community, the person that you live next to, the people that you work with, the people that you travel with. If you're in a place that you're, using public transportation on a regular basis, it's affecting the entire community. And that's how we saw the COVID virus, spread so rapidly, is because of people traveling. And we really are an like the lines, people are moving all across the world.
People are intercontinental, people are international, and they're constantly crossing boundaries and different locales very quickly, and then returning to wherever it is that they are, that they live or reside. Yeah, that makes a lot of sense. And it's funny when you say it like that. I think it brings into focus that are you and this is where the mistrust has validity. So you just want to protect me against spreading the vaccine. For you, you're not trying to protect me a bit in terms of my overall health care and survival. Is that what this is about? You know what I mean?
Right. Yeah.
And they're not wrong.
It's not holistic, right? Our system's not set up holistically in general. So we're lacking community. We don't pay attention to those nuances that every community might need. And we're doing like this cookie cutter for everybody, right? And not everybody's always going to be in the same circumstance as someone else. So I think you hit the nail on the head, right? Like, is this what we're doing?
Yeah. I think we're going to, this will be my optimistic point of view, right? Okay. Is that we learn a lot from this pandemic about how we need to reshape our healthcare system as an entire whole. And it really does need to be shaken up. It's a revolutionary time in that, right? Fortunately, it does seem like we're stuck on one thing right now, and that's vaccinating everybody to try to hurry up and end the pandemic and fix the economy in light of the pandemic. But we really can do more than one thing at a time and really start to look at how this is how our healthcare system, how the practices that are put in place really are not serving a community of people. Right. And that's what I would hope would happen, as a benefiting factor behind this.
Yeah. You really make a really good point with that. So let me ask you this. Do you believe healthcare should be a human right?
Yeah. Oh, yeah. Absolutely.
Basically.
Because right now we're in a capitalistic society where it's your insurance / the Affordable Care Act that has helped several millions and millions of
what people call Obamacare. Is that what you're talking about?
Yeah.
Same
Obamacare
they're trying to strip down?
Yes.
Right. Because they hate Obama.
Yes.
It should be a basic human right. I mean, there's been some debate about that actually being in the original Constitution. That because I don't want to fudge the line, but it was about the health and liberty and just those three things: health, liberty, and justice for all was actually
part of it,
right?
Mm-hmm.
And
so true.
We're unfortunately there's so many principles that this country was founded on. But it's been a lot of hypocrisy along the entire way. And we really have to come to terms with where those values, like what is the real value? I would say, what is the real value would be the good question to start to answer and really be honest about answering it on a public platform.